whether it makes any difference or not in the long run, it's difficult to say. But it's not going to reverse.
Sure.
It's not going to fix anything that's already occurred. Neither the Namenda or the Aricept. But he put, at that time, in-vessel cerebrovascular disease, same sort of thinking. Small blood vessels that are affecting the memory.
It won't reverse it, but is there something that will stop it from getting worse? Or?
If it is not Alzheimer's, no.
Okay.
And even with Alzheimer's, those medications just slow down the progression. They don't stop it. They don't reverse it. They just slow it down.
Okay.
So, that's kind of where we are. It looks like it's, like I said, multi-infarct dementia. Just looking at what's been done in the past. As I said before, the fatigue and the nausea and the weight loss is probably due to the nausea because she's not probably eating as much is probably what's going on there. So, as I said before, my first thing would be let's stop the haloperidol and see what happens.
Okay.
See if the nausea goes away and the fatigue goes away. If it does, that's fine. If we have irritability and agitation and
we won't be able to tell.
If those worsen, then we can try some other medications. The problem with the other medications, and even with haloperidol to some extent, but that's the reason I chose this one, is it's not as much. But all causes of death go up with using these antipsychotic medications in people over the age of 65. So what do we do? That's the big question. What do we do for somebody who's having agitation and irritability? Most of the time, I tell the patients' families that that's, a risk. But the other alternative is doing nothing or putting them on medicines that are going to sedate them. And that's really not a good option either.
So are you who saw her at the ER when Dad brought her in, or did you bring her into here?
No, they've been here to see me.
When she couldn't get over the billfold incident, the wallet incident. You brought her here? Or I thought you brought her to the ER.
Well, I brought her over there, but I'll come here too.
Oh, okay.
Yeah, I think they'd been seen there, and then
I went there.
So I guess I'm asking, was it you who prescribed halo?
Yes, that was me.
Oh, okay.
And as I said, it was to help with those obsessive thoughts, because we talked about reason, how to reason, and there was no reasoning. So
right.
And we didn't start on that strong medicine either.
We kind of
built was over a period of time before we done that.
Okay. One more question. My father-in-law is a pastor in Alabama, and telling him about some of Mom's stuff, he said that some ladies in his church had kind of done the same thing, and they started seeing a geriatrics doctor. Not to discredit you, is it better?
That's a choice. I'm going to say no. I feel like I do a good job, and I see lots of geriatric patients. That's up to y'all as a family, or whatever you feel, and it's not going to hurt my feelings.
No, I don't know. I just feel at a loss sometimes.
What we can do, the other thing we can look at doing is seeing about to get her in to see a psychiatrist or a neuropsychiatrist to see, is there something else we can do? And I have no problem with that, rather than just experimenting and experimenting.
I don't know if Dad told you, she has two sisters who've already passed, but they've experienced the same thing. One of them even full-fledged Alzheimer's. Aunt Lula had full-fledged Alzheimer's. The other one, but just same symptoms, so a little scary.
And I'm not afraid of going to get second opinions and all those things. I want y'all to feel like we're doing everything that we need to do, because I understand, and it's a frustrating disease process.
Right. No, I'm comfortable with you, and Mom and Dad seem comfortable with you. I don't know, just pulling for straws and stuff.
I have no problem, and that's one of the things that has crossed my mind is should we refer to a neuropsychiatrist to see if there's anything else.
What that Oppenheimer, what is he?
He is a neurologist, which is a little bit different. Neuropsychiatrist deals some with the nerve side of it, but also with the psychiatric, the depression, anxiety, and all those things. They are the people who usually treat Alzheimer's patients.
Because I know last time that we went to Oldham, he told us, well, I can't do any more for you.
Right.
Mm-hmm.
And and I think that's probably what the neuropsychiatrist, they may try some things, but, and as I said, it's a frustrating disease process.
Mm-hmm.
And like I said, I don't claim to know everything,
Sure.
and I want people to feel like, so if that question ever comes up, I'm fine going to get a second opinion.
Yeah.
A true geriatrician, they do basically the same thing I do. They just, all they see is people over the age of 65.
Okay.
And that's fine. I mean, I want you to feel comfortable and them to feel comfortable that she's getting what she needs. And if it's not here, like I said, it's not going to hurt my feelings if that's what y'all feel is best for her.
I don't know what's best. It's just,
I understand.
It's all, so, but I guess that was my big question, just I don't know. But if you see geriatric patients too, that's fine.
And I don't know if there's anybody that specializes in just geriatrics in this area right now.
Okay. All right.
So, what do you think about a referral? Do y'all want to get a...
No, I don't see it.
He didn't even know what geriatrics was. He's like, oh, what? I don't know what that is.
That's okay.
So
That's okay.
It is, but you got... I live in Houston. They're not coming to Houston because doctors over here tell them the same thing they tell them in Houston. So, yeah, that's fine. You know, Mom, and so that's good.
Well, let's see what happens with this. Okay. That doesn't mean that we don't make that decision today. That we may not make it next time or even down the road. So let's see what happens with stopping the haloperidol. Hopefully these symptoms go away and we say, okay, that was the problem, which I suspect it is. If it is, what do we do next? Do we just watch and see? Because if she's not to the point of harming herself, you know,
she's not
or
really.
keeping her from resting at night because of the obsessive thoughts, or just causing havoc in the general day-to-day because of the obsessive thoughts, I probably wouldn't add anything else in.
Okay.
If the obsessive thoughts become more problematic, we're having more aggressive behaviors or things along those lines, then we might reconsider, do we do one of these other antipsychotics?
Okay.
Or, once again, do we get her to see her psychiatrist and go from there?
So
there ain't been no aggressive.
Yeah, I haven't seen that. But that may change.
Yeah.
Usually in these types of dementia, it's not as big an issue as the aggressive type of Alzheimer's.
So, but we're going to keep her on the Namenda?
Yeah, oh yeah. I don't think that has anything to do with it. She's been on it for a long time.
Okay, alright.
So,
Okay. Alright.
Well, what about, you take her off, what you call it? The one you...
The
haloperidol.
What about the Namenda?
No, that's what we were just saying. We're going to leave it. She's been on it a long time, so it's not, I don't think it's causing any problem.
Okay.
And as I said before, is it doing anything? I don't know. I don't know how to answer that question. Is it causing a problem? I don't think so.
Now, which one? That last one you put her on, that's the one she's supposed to eat before she takes?
The haloperidol?
Yeah.
It's twice a day. It was supposed to be morning and evening.
Oh, no, that ain't it.
Okay.
The Namenda is the one. No, I don't remember which one.
So the Namenda's twice a day. The thyroid you're supposed to do an hour before you eat anything.
That one.
It needs to be on an empty stomach. And let's look at one other thing thinking about that. Is when did we check that last thyroid test?
Well,
I think we've done it recently.
Yeah, we done that the other day and they said it was all right.
Oh yeah, it's just been 2 weeks ago. So, okay, because that's another thing that can cause ripple effects if we don't watch it. So that's going to be our plan of action. We're going to stop the Namenda.
No. Yeah, okay.
Haloperidol, I got Namenda on the brain now. And let's follow up in about 2 weeks and see how these other symptoms are going.
Okay.
If the nausea and the weight loss and the fatigue and all that stuff stop, like I said, it's the medicine.
Okay.